Kristen Venuti. I'm a pediatric orthopedic nurse practitioner. I'm from Baltimore, Maryland. I work at Johns Hopkins Hospital. And I've had the privilege of being involved in the care of children with scoliosis for over 17 years now. I worked as a bedside nurse for a few years before becoming a nurse practitioner. So I do have the privilege of having had that experience of taking care of kids recovering from spinal fusion surgery in the hospital too. So there often does come a point in the management of scoliosis where a family has to make the decision of choosing surgery. You've decided to proceed with scoliosis surgery. The spine is a delicate network of bones, muscles, and nerves, and it is normal to feel nervous about making this decision to proceed with scoliosis surgery. This should be a shared decision. It's the child, the family, the healthcare provider, and other members of that child's support team that's really involved in making this decision. One thing to consider is the timing of surgery. It often is elective. What are the risks of waiting until next year? When will the recovery best fit into my family's calendar? Review your options. Consider your geographical region. How far are you willing to travel for surgery? Consider some of the logistics involved in a long drive or a flight to really get to the surgeon and the team that's best for you and your family. Of course, the important thing to do is look at your insurance plan coverage. Investigate that. Do you have any out-of-network benefits? Is there going to be an out-of-pocket expense? Identify the major medical centers in your geographical region who offer scoliosis surgery for children. And of course, research. Spend the time that it takes to really get to know your options. Ask your pediatric primary care provider. Ask your friends and your neighbors. Get names. Identify surgeons who are members of the Scoliosis Research Society. The website, srs.org, is a great resource, and there's a search engine for finding surgeons in your zip code in your state. Check the surgeon and the hospital reviews online, and visit social media discussion sites. Some surgeon-specific qualifications to consider. Is the surgeon fellowship trained? Fellowships might include pediatric orthopedic surgery, spine surgery, neurosurgery, or pediatric spine surgery. Do some research into how many years the surgeon has been in practice. And how many years has this surgeon been at the current institution? Research whether he or she has been involved in scoliosis study groups and has been involved in research and publications. Surgeon experience is an important thing to consider. In 2014, a study was published in JBJS concluding that the operative results and health-related quality of life following surgery for AIS were significantly and positively correlated with that surgeon's experience. Therefore, choose a surgeon with experience. Consider the reputation of the hospital and the surgical team as a whole. Surgery is a team approach. The surgeon, the nurse, the anesthesia team, everyone really is involved in those individual patient outcomes. Schedule a surgical consultation. Come prepared with questions. Kids, write your questions down. Parents, really think of every question that might come to mind. You want to consider the details of the surgery itself, any restrictions that are imposed after surgery, and what that immediate recovery is like and the long-term outcomes of surgery. Take the time to really pull together all of your medical records and bring those with you. Any previous x-rays, any clinic notes from an outside orthopedist that's been following your child. If he or she has been visiting with a physical therapist and has gone through brace treatment, that's important information to have too. Sample questions that you might ask your surgeon or surgical team about the experience. Is pediatric spine deformity your specialty? How many years have you been in practice? How many cases like mine do you perform each year? And do you have a pediatric anesthesia team? Understand your curve and ask questions about it. One question might be, am I a candidate for a selective thoracic fusion? What is your surgical plan? And what levels do you anticipate need to be fused? And may I connect with another patient of yours who's been through this experience in the past? Questions to ask yourself. Do you have the surgeon's full attention? Is the surgeon someone that you as a family feel comfortable with? Does the surgeon really take the time to help you understand all of your options and the pros and cons of each option? Does he or she provide you with the research to support these treatment recommendations? And do you really feel like the surgeon is working to find the best treatment for your particular case? And lastly, do you feel like the surgeon is supportive of your decision? Thank you.